Kenya is facing a concerning surge in new HIV infections among young people, with recent national health data showing that youth aged 15 to 34 now account for 74% of all new adult HIV infections. While the nation had recorded a marked decline in new infections over the last 6 years, the 2025 NSDCC report documents a troubling increase in 2024, signaling a potentially dangerous shift in the epidemic's trajectory. The report highlights a 19% increase in new HIV infections over the last year, with total new cases climbing from 16,752 in 2023 to 19,991 in 2024. The epidemic is heavily concentrated, with 10 counties collectively accounting for 60% of all new infections. Nairobi County leads the tally with 3,045 new cases, followed by Migori with 1,572, Kisumu 1,341, Homa Bay 1,180, Busia 886, Siaya 873, Kakamega 835, Nakuru 819, Mombasa 817, and Bungoma at 679. In response to rising infection rates in traditionally non-circumcising regions, local leadership in counties like Turkana is taking a proactive stand. Authorities in the region have recently urged men to embrace voluntary medical male circumcision. Historically, circumcision rates in Turkana have been hovered between 5 to 10%, well below the national average. The reversal of progress comes amid heightened financial pressure on the national health system, which remains heavily reliant on international partners. As donor funding wanes, the long-term sustainability of the HIV response is threatened, leading to treatment disruptions and increased costs for patients. Some months back, as concerns over commodity shortages mounted, the Director General for Health, Dr. Patrick Amoth, offered reassurance, stating
that we have sufficient stocks of HIV commodities, be it antiretrovirals, be it the testing commodities.
However, even with this assurance, people living with HIV have staged protests demanding that comprehensive HIV services, including essential lab tests like viral load, CD4 counts, and diagnostics for core infections, be included in the Social Health Authority (SHA) coverage. Protest organizers emphasize that the people living with HIV community is at risk and that HIV services should be fully covered under the SHA as donor funding walls. The national HIV prevalence rate stands at 3%, with 1,326,336 Kenyans currently living with the virus. Globally, Kenya remains the 8th highest epidemic in terms of absolute numbers, trailing the burden carried by South Africa, India, Mozambique, Nigeria, Tanzania, Uganda, and Zambia. And now, to flatten the rising curve, experts are urgently emphasizing foundational public health practices. They urge that all sexually active individuals should get tested to know their status, and that if you are in a relationship,
get to know your partner's status. Don't just be having sex with someone whose status you don't know.
Furthermore, for those who test positive, the critical message is to start
treatment. And treatment is best when it starts early, before you get advanced disease.
To manage the virus, protect their health, and prevent further transmission.